Just gone 7:15 here on this Thursday morning. So the National Institute for Communicable Diseases has expressed concern at what it calls a sustained increase in the number of laboratory-confirmed COVID-19 cases in the country. In the latest reporting period, South Africa recorded the highest number of new coronavirus infections in more than 4 months, indicating that the country is officially entering the third wave. We're now joined on the line by the National Institute for Communicable Diseases Executive Director, Professor Adrian Puren. Prof, thanks very much for your time this morning.
Good morning to your viewers as well. Thank you for the opportunity.
Is this the turn? Is this what we've sort of been analysing in terms of the scientific meaning behind South Africa entering into a third wave? We know about the 4 provinces of major concern, but would you now define South Africa in a third wave?
I suppose technically one could. I think the number was 5,600 and odd. I think so. In SA we have reached that particular threshold for the country as a whole.
Yeah, so the new cases, just to give them to you, I know I've got them in front of me, so it's 5,782, and I think we're looking at about 110 deaths. This indicating now that we are at a 12.7% positivity rate.
That's overall, yes.
That's a cause for concern, I imagine.
It is, and remember that that the overall positivity is at that particular value. But if you were to disaggregate it by province, of course, then the positivity rate will certainly be higher. For example, in Gauteng, it's about 17%, Free State about 15%, and the Northern Cape 23%, and the Northwest 18%. So that really means that we should really, as far as is possible, enhance our testing to really get a better sense and identify cases in order to get a better sense of the current outbreak in South Africa. And that obviously has implications, as you've mentioned, death, but also immediate concerns would be our hospital capacity to manage these particular cases. Yes.
Yeah. Are we noticing anything different with this wave that we're going through? I mean, we obviously within Gauteng we're seeing a very sharp rise now. It used to be more the coastal areas and provinces that we saw dramatic rises. But if we look at that red line, because that's representing Gauteng, I mean, we're seeing a very sharp rise. Perhaps you can talk to us about the kind of trends that we're seeing in this wave as opposed to the previous ones.
Yes, it is very interesting to observe that it's more the inland provinces. As you know, it was really the Northern Cape, the Free State, and I guess the Northwest that had gone through its particular entry into, I suppose, the so-called third wave or resurgence, and then followed by Gauteng. And so that's very different, and I guess the dynamics are not always clear why that would occur. And one of the thoughts were around, for example, particular events that may have sparked these off, congregant events, as well as the fact that perhaps the immunity levels as well in our different communities may also be giving rise to the different trends that we are currently observing. So Gauteng was really the outlier in terms of the severity of the third wave or resurgence compared to other provinces. But again, that was really dependent on the fact that we would implement either very strict non-pharmaceutical interventions, that's the wearing of the masks, the physical distancing, the ventilation, and so on. And if those were well implemented, then we would not see the resurgence to the extent that we saw in the second wave.
I mean, when we're already seeing numbers such as these that are being reported, I mean, is this an indication that, I mean, there are far more infections around? That we always know that there is an underreporting of numbers. It's an obvious fact that, I mean, we've been going through this for a while, so we always know that number is a lot larger. But in circulation right now, I mean, is it of greater concern that these numbers may be 3 times more than what we are actually reporting?
Absolutely, and as you know, there could be asymptomatic spread as well, I think, which is a major contributor, one of the major contributors, but also individuals who may well have symptoms but are not going for testing. And we hope that those individuals are managing to cope, and there are no severe outcomes for those individuals. So we really are focusing, I would think, on those individuals who are presenting to our clinics and our hospitals who may well require attention. But you're quite right. the numbers are probably far larger than this. And I think the seroprevalence studies that have already been published or are available or will become available will definitely show you that the prevalence is far higher than what we're seeing with regard to the testing rates and positivity rates.
Is there news yet on the current strain that we are having in South Africa? Because, I mean, we had heard, and please forgive me, I know that the new strains from the countries of origins have been given letters from the Greek alphabet. I do know that. But I want to just refer to the kind of strain. I know that we're still having, the one that was discovered here in South Africa as our dominant strain. However, there are a lot of concerns about the one first discovered in the UK and the one in India. So perhaps you can give me the proper scientific names that the World Health Organization has said, and do we have results? Because I do know those took a little bit of time to get to and to find out what that strain is now that's coming through.
Yeah, so I need to practice the Greek alphabet to get them correctly. So I'm going to refer to specific strains that are in circulation. So for South Africa, the dominant strain that is in circulation, as far as I know for now, is the same strain as what we saw in the second wave. However, you're quite right to raise the point that we did identify strains that were identified in the UK and in India. There was low levels of circulation of those particular strains, but as far as I know, that those strains have not taken off, but it's already critical for us to keep an eye on those particular strains because they are and look to be more transmissible than the current strain that is dominant in South Africa, and they could well displace that. And you've seen that in the UK and in part in the United States, where for example, the strain from India has certainly become fairly dominant, and but it's really dominant in a regional way rather than at a national level. I think what is very important in those particular scenarios is really the vaccine coverage, and that seems to really be an effective way for us to try and control those levels of those particular types of variants. But we have a way to go around that, so it's really critical as we come back. I know we've entered into a so-called readjusted level 2, but the effects of that will only really be seen in the next 2 to 4 weeks, for example.
So the vaccines, we're over 1 million. We've spoken to this. Obviously, people would like to see this moved faster. There are different groups that really want to see the vaccine coming their way. So, but the question I need to ask you as we sort of wrap this up, I know you're saying that these lockdown effects that we're now just the adjusted ones. I mean, there's nothing too dramatic. I mean, we've just pulled the curfew through an hour earlier, and then obviously the gathering number has come down slightly. Not that much because it's still happening. However, from a scientific point of view, because we understand the economic effects, and that is something we always need to keep in our mind, is that, shutting businesses down, it's the worst thing that we can do to a country, and especially South Africa now as we're trying to turn. However, scientifically, particularly what we saw at the end of last year, we saw more regional, where we saw the waves and the predominant places that we were getting infections, different lockdown levels there as opposed to the rest of the country. Do you think it would be safer to go that way? I mean, just looking at Gauteng, it's a great concern to see how we're rising and so fast.
Yes, I would tend to agree with you overall, because I think that has been the strategy. You're quite right. There was a selection of a particular district or sub-districts in the Eastern Cape. But then again, we had to introduce an adjusted level 3, for example, based on those particular trajectories. But if the modelling is correct in terms of what the scenario painting has given us, then perhaps we will possibly not necessarily go to that level of level 3, perhaps, but maybe in a nuanced way, as you said. For example, Gauteng, you may have an adjusted level 3, for example, to manage that if we are unable to control the current trajectory. So I think you're quite right. A nuanced approach may well be best suited rather than a full-scale level 3, for example.
Yeah.
These are obviously under intense discussion, I'm sure, as we try and model the numbers as in real time as is possible.
Prof, before I let you go, one last question. I've just been given an extra minute. The vaccines. Let's talk about this. Are you satisfied with the pace we're going? I mean, I can answer that question for you, but I mean, you're more in the know-how. What are you seeing? Is this Are we too slow? Do we still need to speed this up even faster? I mean, we have seen it move faster, we really have, but I mean, is this still not where we need to be as a country?
Well, I think the Department of Health has already stated clearly that in their view, they would like to go faster. I think the Minister of Health has been quite clear about that. But I think what has really been helpful, at least from my perspective, is the fact that we are trying to cover the healthcare workers. And as you know, that's been the vulnerable group, and because of if we get overwhelmed, and that overwhelms our particular system. So I think from that perspective, I think that's been a good thing. But I think obviously, yes, we would like to see that the vulnerable groups, especially those in specific age categories with comorbidities, receive the vaccine as soon as possible, because that, again, will really stave off this particular third wave as best as possible that we can achieve.
And Prof, a lot of people are getting messages now that have received the Pfizer vaccine. Initially, it was a shorter gap given. It was said 21 days. I know that as soon as you got the vaccine, you got the message saying you need to come back in 21 days for the next shot. People are now getting a message saying come back in 6 weeks' time. Are you happy with this new change?
So I think that's a reasonable strategy. I think it's a pragmatic strategy, given the rate in which we are currently receiving vaccines. And this was tried in the UK, and I think there are some publications now, and I think also the United States, that pragmatically you can extend the time, because I think the level of vaccine efficacy or effectiveness is not markedly reduced by extending the time to the second dose.
All right, let's leave it there. Prof. Puren, thank you. Thanks for talking to us this morning. He, of course, is Executive Director at the National Institute for Communicable Diseases. Quick break. We'll have your headlines after this and some sports news with Valen. Stay tuned.